Welcome. Today we're diving into the world of extracorporeal shockwave therapy, or ESWT, a non-invasive treatment that's been making waves in the management of musculoskeletal pain. Since its introduction in the 1980s, ESWT has evolved from treating kidney stones to addressing a wide range of chronic pain conditions. This video will guide you through how ESWT works, its main applications, and what the latest research says about its effectiveness. Whether you're a patient, a healthcare professional, or just curious, you'll find valuable insights here. Let's start by understanding what shock waves are and why they matter in medicine. Shock waves are high-intensity mechanical waves that last just microseconds. They're characterized by a rapid positive phase followed by a negative phase, creating a unique energy pulse. In medicine, these waves are generated outside the body and directed at specific tissues to promote healing and pain relief. The technology behind ESWT allows practitioners to target problem areas with precision, making it a popular choice for various musculoskeletal conditions. But what makes these waves so special? It's their ability to trigger biological responses in the body, which we'll explore in the next scene. ESWT was first used in the 1980s for breaking up kidney stones, a process known as lithotripsy. By 2000, its use expanded to treat delayed bone healing and chronic pain. Plantar fasciitis was the first orthopedic condition to receive FDA approval for shockwave therapy, paving the way for broader applications. Over the years, research has uncovered more about how ESWT can help with various musculoskeletal issues, from tendinopathies to osteoarthritis. This evolution reflects ongoing innovation in non-invasive pain management. Main mechanism behind ESWT is called mechanotransduction. When shock waves pass through tissues, they trigger a cascade of biological effects. These include pain relief, increased blood vessel formation, enhanced protein synthesis, and even the breakdown of unwanted calcium deposits. The waves can also stimulate tissue repair and protect cartilage and bone. While the exact physiological mechanisms are still being studied, the clinical results are promising, especially for chronic pain conditions that haven't responded to other treatments. There are two main types of shock waves used in therapy: focused and radial. Focused shock waves penetrate deeper into tissues and are generated by electrohydraulic, piezoelectric, or electromagnetic devices. Radial waves, on the other hand, are produced pneumatically and have their highest intensity at the surface. Each type has its own advantages, depending on the condition being treated. Understanding these differences helps clinicians tailor treatments for optimal results. ESWT's biological effects are wide-ranging. It can decrease pain by reducing substance P in certain nerve fibers, promote tissue repair through increased collagen synthesis and neovascularization, and stimulate bone healing by activating osteoblasts. These effects make ESWT a versatile tool in treating both soft tissue and bone-related conditions. The therapy's ability to trigger these responses without surgery or medication is a major reason for its growing popularity. Applying ESWT involves targeting the affected area, often using palpation or ultrasound for precise localization. Protocols vary depending on the condition, but typically involve several sessions spaced over weeks. The intensity, number of pulses, and frequency are adjusted based on the pathology. For example, tendinopathies and osteoarthritis might require 4 sessions, while bone healing issues may need fewer but more intense treatment. Clinicians monitor progress and adjust protocols as needed for the best outcomes. Effectiveness of ESWT is supported by a growing body of research, including systematic reviews and meta-analyses. Conditions like calcific tendinopathy of the shoulder, lateral epicondylitis, greater trochanteric pain syndrome, plantar fasciitis, and delayed bone healing have strong evidence backing ESWT. Other conditions, such as patellar and Achilles tendinopathies, osteoarthritis, and carpal tunnel syndrome, also show positive results, though the level of evidence varies. This makes ESWT a valuable option for many patients with chronic pain. ESWT is particularly effective for various tendinopathies, including those affecting the shoulder, elbow, hip, knee, and Achilles tendon. Chronic tendinopathy often results from poor blood supply and repetitive stress, leading to pain and reduced function. Studies show that ESWT can help repair tendon fibers, reduce pain, and restore mobility. For example, high-intensity shock waves are recommended for calcific tendinopathy of the shoulder, while lower intensities are used for other tendons. Plantar fasciitis, a common cause of heel pain, responds well to ESWT. The therapy helps by promoting tissue repair and reducing inflammation in the plantar fascia. Studies involving over 1,000 patients have shown that ESWT leads to greater pain reduction, improved function, and faster return to daily activities compared to other treatments. This makes it a go-to option for those struggling with persistent heel pain. ESWT is also used for axial pain conditions, such as myofascial pain syndrome of the trapezius and chronic low back pain. For myofascial pain, shock waves can regulate the extracellular matrix and reduce trigger point sensitivity. In chronic low back pain, combining ESWT with exercise programs has shown to improve pain, though functional gains may be limited. These findings highlight ESWT's role in comprehensive pain management strategies. Osteoarthritis, the most common musculoskeletal disease, involves joint degeneration and chronic pain. ESWT has been shown to reduce pain and improve function in patients with knee osteoarthritis, outperforming placebos and some other treatments. Moderate intensity sessions seem to offer the best results. While more research is needed to standardize protocols, ESWT is emerging as a promising adjunct therapy for osteoarthritis management. Shockwave therapy is not just for soft tissues, it's also effective in promoting bone healing. For conditions like fracture nonunion and bone marrow edema syndrome, ESWT can stimulate bone regeneration and consolidation. Studies show that its effectiveness can be comparable to surgical interventions, especially in hypertrophic nonunions. This non-invasive approach offers hope for patients facing prolonged recovery from bone injuries. ESWT has also shown benefits in less common conditions like Kienbach's disease and pubis osteitis. In Kienbach's disease, patients experienced improved pain, mobility, and MRI results after therapy. For athletes with pubis osteitis, ESWT led to faster return to sports and better pain control compared to placebo. These cases illustrate the expanding potential of shockwave therapy in musculoskeletal medicine. Carpal tunnel syndrome, a common nerve entrapment condition, can be managed with ESWT as an alternative or adjunct to surgery. Research indicates that both radial and focal shock waves can improve pain and function, with radial waves showing slightly better results. When combined with conservative treatments like wrist splints, ESWT offers short-term relief and functional gains for many patients. Evidence supporting ESWT is robust, with numerous high-quality studies, systematic reviews, and meta-analyses. These studies cover a wide range of conditions and provide valuable insights into the therapy's effectiveness. However, there is still variability in protocols and comparison groups, which can make it challenging to draw definitive conclusions. Despite these challenges, the overall trend is positive, with ESWT recognized as a safe and effective option for many musculoskeletal problems. While ESWT is promising, there are limitations in the research. Protocols for application vary widely, and there's a lack of standardization in treatment parameters. Many studies compare ESWT to different conservative treatments, making it hard to isolate its true effectiveness. There's also a need for more research on combining ESWT with other therapies and on its use in less common conditions. Addressing these gaps will help refine its role in clinical practice. ESWT is generally safe, with few reported adverse effects. However, it's contraindicated in patients with bleeding disorders, acute infections, pregnancy, or when treating areas with active cancer or growth plates. High-intensity treatments may increase the risk of bruising, and caution is advised in older patients or those with tendon ruptures. Overall, when applied correctly, ESWT offers a favorable safety profile. Future of ESWT looks bright, with ongoing research aimed at understanding its mechanisms and optimizing treatment protocols. As more high-quality studies emerge, clinicians will be better equipped to standardize care and expand ESWT's use to new indications. The therapy's non-invasive nature and broad applicability make it a valuable tool in modern musculoskeletal medicine. Sum up, ESWT is a non-invasive, safe, and effective therapy for a wide range of musculoskeletal conditions. Its main strengths lie in pain relief, tissue repair, and bone healing, with evidence supporting its use in both common and rare pathologies. While there's still work to be done in standardizing protocols and understanding its full potential, ESWT is already making a significant impact in pain management and rehabilitation. Thank you for joining us on this exploration of extracorporeal shock wave therapy. As research continues and protocols become more refined, ESWT is poised to play an even greater role in managing musculoskeletal pain. If you or someone you know is struggling with chronic pain, ESWT may be worth discussing with a healthcare provider. Stay tuned for more updates as this exciting field evolves.